Hello.
Okay. I think I can hear now. Good evening, sir.
Hajiya, how are you?
I'm fine, thank you.
Okay. Should we still say Happy New Year? Still.
Yeah, for me, the year has not even started. I'm still on leave.
I envy you.
I'm on maternity leave.
Oh, okay. Oh, great. Great.
Yes,
Well
sir.
done. So
Thank you.
you've been very busy then.
Yes, I've been very sleepless nights.
Yeah. Yeah. Oh, that's true. That is true. That is true. That is true. Ah, okay. At a stage when they can't even talk. All they do
Yeah.
is cry and cry and cry.
We're 3 months, few days back.
Well, it's yeah, great, great. Congrats once again. Now I remember.
Thank you, sir.
Yeah. I think you have a sizable number of people.
Okay.
Yeah. But is that all left to you if you want us to start now? It's all left to you.
Yeah, I think we can start.
Okay.
Yeah. Someone is saying that they can't hear, but please, if you can hear, do let us know. And if you cannot hear, also do let us know so that we know where the problem is coming from. Probably maybe your audio might be off or something. Maybe that's why. Okay, Mary said she can. Hi, Mary. It's so good to see you. I can see some of it's been like over a year. I went live on Facebook so I could see some of my Facebook friends here.
Okay.
Yeah. So nice. Even Ruth, I saw Ruth and some other people. It's so good to have you. I think we have a sizable number. We can just go ahead and start.
Yeah.
Okay. Okay. So this is a fertility forum. We'll be asking some questions. I got so many questions that I actually did not know where to start from. But I actually selected some and I left some based on our engagement later on. I know we'll eventually get there and we'll get to address everybody's question gradually. But for now, let's just start gradually. If we don't answer your question today, just know that we'll answer your question in future by the grace of God. So we're going to take them gradually because we know we're going to do something on hypho and talk about fibroid, adenomyosis. And so questions like that, I left them out on purpose because I know you benefit better there than it's been answered now. So please, if you didn't see your question, please bear with me. We're going to attend to your question eventually. So I want to start. My first question, this is a general question, basically that why is it necessary for couples who are trying to conceive to have a preconception plan?
Yeah. Okay. Great question. Yeah. When we talk about preconception plan, we're trying to say, okay, what is the present state of health? What are the challenges? What do we need to take care of even before you get pregnant? You know that there's some diseases that get worse in pregnancy. If such a thing is present, what do we need to do before that? So I think that's one thing that is really is not too popular in Nigeria, which we wish it could be, just like also early pregnancy care too. You know, we just lump everything together in Nigeria. And that's why miscarriages and so on and so forth are not well handled because we don't have special clinics for them. In other climes, you have special clinics for preconception, you have special clinics for early pregnancy, you know, before you jump into the normal routine antenatal care. So preconception care and counseling is so important in that it tells you what are the things you need to look out for, what are the things that need to be taken care of, either that can have the potential to affect the pregnancy or the baby, or have the potential to affect the mother's health, or that can be transmitted to the baby. So these are the things that we take care of during preconception care. And I think it's getting a little bit, a few clinics are now doing it, but majority of Nigerians just want to get pregnant and they just get pregnant without knowing actually, what do we have? Am I pre-diabetic? Okay. Can it affect the sperm? Can it affect, those things are very important. Do I need to control, if you have a family history of diabetes, do I need to check my HbA1c, glycosylated hemoglobin before getting pregnant? Those are things that are very important. One of the things also is that some people, of course, taking folic acid routinely is also part of that. Is to get you ready for pregnancy so that we don't pass some things on to the baby, and also that your own health does not suffer because of the pregnancy.
And also, personally, I think when you have a preconception plan, it helps you put things in focus and you don't feel much stress, anxiety, rather than just jumping into it and then meeting so many things. And it reduces your stress level, makes you feel in control and in charge because you have done the right steps, seen what and what before going into the fertility itself, trying to conceive itself, rather than dealing with you're already into it, you start facing recurrent miscarriages. That's when we now go back and start saying, okay, what do we do to curb this and curb that? You're feeling stressed, you're feeling frustrated, and make things more even difficult for you in the first place. So that's from my own personal point of view and my own experience, I noticed. From the other question I saw again, a lot of people do not know they are even supposed to do fertility testing before when they are trying. You see people it's after you've taken different concussions and then you've tried this, you've tried that, it doesn't work, then that's when you go back. So what are the tests you need to carry out before, if you're trying to conceive, what are the tests you need to do?
Okay, right, thank you. That's another very important question. But maybe before I answer that, I say that if you are less than 35, okay, if you have tried for 1 year, you need to start looking for help. If you are over 35, then after 6 months, you need to look for help. Now, what are these tests that we need to? If you are 40, you need to start looking for help like immediately, Now, what are these tests that we need to do? We need to look at the semen analysis of the man. Okay, this probably is the easiest test to do, but most of the time is the test that is not done because women is just we still have this cultural belief that it's a woman's problem, and therefore the man also has some stories to tell. Somebody got pregnant for me last year, blah, 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 blah. But most of the time we know that this is not true. I've seen so many men with no sperm count at all who said people got pregnant for them. So semen analysis is very, very important. Now, the commonest reason why women, because what we're trying to do is look at the common things that cause infertility in this environment. So the sperm count or the semen analysis is important. Then we do a test to look at what the tubes are like, So we do this test that we call HSG. It's a radiological test which look at the tubes and the uterus. And then once we've done that, then we do a blood test to see what is the ovarian stock at that point in time. Because, I keep telling people that the thing that we use are just the sperm and the eggs. And really and truly, that is what determines the capability of the couple to conceive, whether they're using IVF or they're sleeping on the bed, is the quality of the sperm and the egg. So we look at what the ovarian reserve is like at that point in time. Some people might want to see whether you're ovulating or not. Well, that's very secondary. The most important thing is what is the ovarian reserve, because that's what we're going to use. And then the fourth test is that we do a scan, because we know how common fibroids and polyps and stuff like that are in this environment. So those are the four tests that must be done. There might be some additional tests that can arise from these four basic tests. But what we've seen is that when you have done these four basic tests, you will have been able to tell about 80 to 85% of the reasons for infertility in this environment.
Okay. So, and the problem with also male infertility is that I made a post sometimes. Somebody said, am I advising the woman to divorce the man because he refused to test? And I feel that why for 14 years she has been trying and he has refused to test. So what she should do, I put the question back to him, what she should do. It's very, very important for your husband to test because it takes two to tango. Even if you're 100% okay, and he is not okay, there's no way fertilization can take place. And there's even solution these days. So I don't know, the fear of the male ego that no, there's solution, there's always solution. If he sees a specialist, maybe probably there's a reason why he has azoospermia, zero sperm count. They'll find out with assisted reproduction these days, so many things, the solutions to many problems that people are not even aware of. So awareness also is another problem we don't have. And that takes me to my next question that has to do with the latest in reproductive technology. Please, doctor, just tell us, what are the latest in reproductive technology?
Well, thank you again. Nice question. There's so many things going on in the realm of reproductive technology now. There's some that are still experimental, there's some that are already with us. For example, we know that gene editing has started. That's probably the realm of, we've started also experimentally to start growing eggs in the laboratory, but that's experimental, but maybe it will take 10, 15 years for that to come to, but it's something to look forward to in the future. But right now, of course, one of the things that there's so many, PGD is one thing that is with us, where you can look at, I get people asking whether 2AS can get married. I still don't encourage it, but it is possible because you can do PGD to be able to, so that you don't transmit the genes to the baby. But of course, there are other genes that we can use PGD for. Albinism, congenital blindness, congenital deafness, all these things that as we call them monogenic disorders. We can use PGD to eliminate that. Of course, we can use it to determine the gender of the baby also. So these are some other things. And then in the realm of even male infertility, we are doing what we call DFI, DNA fragmentation index for the men. Because we see that there's some men, the sperm count seems to be okay, motility seems to be okay, but they don't fertilize good. And so we see that the DNA, because what do we, as men, what do we really contribute to fertilization? We just contribute our DNA to the DNA of the eggs in order to form another organism or human being. Now, if the DNA that we are contributing to the equation is already fragmented, the quality of the embryo is not top-notch. Therefore, sometimes it's that it burns out early, what we call miscarriage. Sometimes it just does not continue to develop at all. And we have seen that so many things contribute to this DFI. Things like the age of the man. When a man is above 45, the DFI is higher. We have seen also that if you smoke, DFI is higher. When you are obese as a man, DFI is higher. So some of those things are things also that is coming into the realm of fertility treatment. And also there's some things coming in to see how we can treat such things. So those are some of the new things that are coming into the realm of the other things. Like we say, IVF is more like bread and butter now to everybody. Even conductors talk about IVF now these days. So, but there's some spin-offs from it, especially from what you said about male factor infertility. That's something that we're really waking up to now, that male factor infertility is a big issue. And where they have figures, it seems as if male factor infertility might be increasing. Well, we did some studies even here with us, and we saw that when we compared about 10 years apart, we looked at the sperm samples that we were getting 10 years apart, and the ones that we were getting about 3 years ago, we saw that the decline was about 30% from over 10 years. So we could say, we could infer that roughly it has been decreasing by about 3%. And that is very significant, even for this environment. And this is not far from what people have seen all over the world. And we also looked at about 3,000 sperm samples. We saw that about 12% of the men did not have any sperm at all in their ejaculate. So these are some of the things that we're seeing, that male factor infertility actually might be the elephant in the room in future.
Oh, thank you very much, sir. Because, before the whole emphasis on the woman, especially because she carries the baby, and especially for IVF, the man feels he has done his own part, and the woman has this guilt that he has tried and everything is about her. Before, we don't talk about age and male-related the sperm quality, how it affects them. It's only women that we feel age only affects the egg. So I'm glad research is beginning to look at all those things and putting them into perspective, that even the man, age also affects the sperm quality as well. So that's, with that, I know we'll get solutions to that. Then another thing I want to also talk about is the PGD. At least it also helps with even the PGD. You now have to put embryos that are healthy, and apart from being healthy, the chances of implantation of those embryos are also higher. So that's one good news with genetic testing again before putting it to the in the woman. So I really encourage. You said IVF is common. Everybody is doing it. It's like pure water, and this now differentiates the big guys from everybody. So it now puts a particular class to it, that these are the things you must look into if you are, that makes us better, or gives us better results than others, since it's becoming this rampant right now. And at times people come to me and say, please, can you refer me to a center that is cheap? And I told them that at times when it's too cheap, there's a cost somebody is keeping. So you want to put all those things, not because they're doing promo or it's so cheap. You have to consider the quality of care you're going to get from that, and how is the simulation done. You have to ask what kind of drugs, what quality of drugs also would be used for the stimulation. So at times, if it's that cheap, you have to ask questions, especially for this 400, 600. I've seen issues like that. At the end of the day, they tell you stories that they don't even tell you any reason. They don't even have a reason why it didn't work. Even if they know it wasn't even going to work in the first place. But some people are actually still lucky, and they come out with a successful circle from centers like that. Another thing that is very, very, we see every time question is somebody who wants to go for IVF. She had maybe probably a previous ectopic and wants to go for IVF. And then this person has hydrosalpinx. That means the person had fluid in the tube. Is the only medical solution removal of the tube, or is there any other way that this person can be managed without the tubes being removed?
Yeah, well, maybe the best way is to remove the tube, but probably through laparoscopy, not opening the person up. But other things have been tried, which I'm a little bit reluctant to talk about. Other things have been tried, like blocking the tube without removing it. But I don't want to talk about that so that people don't hear me out of context. So let us say that the best thing to do is to just remove the tube, but probably through the laparoscope.
I've been meaning to ask this question. It's been on my mind. This ovarian rejuvenation, personally, I've seen it in maybe other countries like US, even in UK, they don't really do ovarian rejuvenation. In Greece and some countries. But I had somebody telling me that in Nigeria, there are some small hospitals that do ovarian rejuvenation. I don't know why. If it was that, why are you people not practicing it? Or does it not have any significance?
Yeah, you see, in medicine, we try to, especially in fertility medicine, there's so many things that come up. Until everybody agrees that this works, it will be said to be experimental. Okay, so ovarian rejuvenation is still, let me put it at best, experimental. So many people will probably not want to touch it. Just like you said, is it done in the UK? You know, the UK has one of the stringent controls over assisted conception, and it's not done. It's not even done widely in the US. There's a few clinics that do it, yes, but it's not done. It's not acceptable widely. So probably there's some things we still need to learn about it. Maybe after some time, maybe it might become something that, but there are anecdotal reports about it working, but I think we need to wait until we know that this works before, the problem with this is that All these things cost you money. And that's why, for example, in the UK, why they're so stringent about this, because the government pays part of it. And the government does not like wasting its money. So they only stick to those things that has been proven to work. And so that's the only thing I'll just say that at best, it can be said to be experimental, but it's still not something that everybody is on board with.
Mm-hmm. Okay, I'll bring back that question because I've seen people who said after ovarian rejuvenation, they did their FSH and they found that the level of FSH dropped, their AMH increased and everything. So I belong to a particular platform where they talked about it. So I saw so many positive reviews. Those one or two people still didn't see any results, even after doing the ovarian rejuvenation.
Sorry, Hajiya, let's talk about this FSH AMH. I think people make the mistake and think that the fact your FSH AMH is related to pregnancy. It's not. It's really related to whether we can get eggs from you or not.
Yes.
You understand? So even if you are 42 and you go and do whatever and your FSH, let's even for the sake of argument say your FSH comes down. What about the genetics? What about the aneuploidy rate? Do you understand me? So I think we need to be careful a little bit when we talk about all these things. You know, it's just like me now that I'm gray. I go and blow my hair. It becomes so much. Is it going to change color? Do you understand me? So that's the thing. That's what we need to be careful about.
But what they are saying is that it produces new eggs, not old ones. So they have new eggs compared to, so it's not genetically, it doesn't affect the age of the woman. So it's now saying that a woman can now produce new eggs. You know, before it was thought that a woman is born with all her eggs. So now it is believed that a woman is no longer born with all her eggs, that even at her old age, she could still produce new eggs. Well, let's leave it for now and continue because we have so many questions we need to answer. Somebody asked in the platform that she has endometriosis. That what are her chances if she wants to go for IVF or IUI?
Well, the first thing is that, well, it depends on, you know, the class, the grade of the endometriosis. Now, very few people, it depends on her age, it depends on the grade of the endometriosis, it depends on what is the sperm count of the husband. So it's a difficult question for me to just answer. So do you qualify for IUI at all? That's one question, you know, because many people don't qualify for IUI, especially when other factors are present. So what they only qualify for will be IVF. Now we know also that your reproduction, the capability to reproduce is affected by endometriosis. Yeah, that's the jury is out for that. But we know that the eggs that you produce is reduced. We know that the plantation is reduced. It affects so many things. So I just think what I would say to that person is that we don't know her age. So, but even if she's going to do IVF, she should just choose a clinic where they have some experience with the condition, and then God will be with that.
Okay, thank you so much, sir. There's another question. Can someone with cervical prolapse get pregnant?
Yes.
Thank you, sir. This one, I see it all the time. I don't know if there's if there's hope or what's the way forward. If someone with a hypoplastic uterus, what is the medical solution for that?
Well, there's so many, because when we take diagnosis out, it's difficult because hypoplastic uterus could mean so many things. Mm-hmm. I've seen normal size uterus being said to be hypoplastic, you know. So, and it's possible to have Turner syndrome and have hypoplasia at the same time. So it might be difficult for me to say that, but if the woman is menstruating regularly, everything is okay, probably they could just, like what we do sometimes is just, we give some hormones to give it over time to see whether the uterus builds up, and then everything is okay. So it's say that again.
In the situation where she's not menstruating.
Because sometimes when she's not menstruating, is that she has some other things that is not only the hypoplasia of the uterus. There might even be some problems with that in our renal system, you know. Mm-hmm. So what that person needs first and foremost is a comprehensive assessment. Sometimes a karyotype might also be done to complete it, to know that actually there is no other thing that is missing. So that's when you have all that you can know how to help such a person. So, but of course, sometimes also we can use donor eggs. Depends. There's no fixed answer. The first thing is to get the diagnosis right. And then, because sometimes we can use donor eggs. Because she has a uterus, we can just build up the uterus and then use donor eggs, and then she can get pregnant. So it depends on what exactly we are dealing with. So I was just saying that you need a proper assessment, and then we take it from there.
Okay, thank you so much. What is a solution to, is IVF actually a solution to recurrent miscarriage? Because a lot of people think that once you're having recurrent miscarriages, if you go for IVF, it's going to manage that particular issue. Is IVF actually a solution to somebody who is actually having recurrent miscarriages?
Yes, it can be, because there's so many reasons why there are recurrent miscarriages. We have to also complete the cycle. If, for example, a 40-year-old or 42-year-old is having recurrent miscarriages, age could just be one of the things that is causing the problem. You know, if such a person uses donor eggs, you might not have that. But there are other things. The first thing is always to do a proper assessment of who we are talking about, to look at, we can find out why she's having this recurrent miscarriages. So, you know, because one of the things to do will be to take the product of conception when she aborts, okay, take part of it and find out why this has happened, you know. But most of the time, you know that people don't do that in Nigeria. Once you have a miscarriage, you just throw everything away. But one of the things that we can do with somebody who has recurrent miscarriage is to take part of the sample and go and test it in the lab. See, does this the embryo that became the baby, does it have a complete set of chromosomes? Because sometimes it is what has been inherited from the parents that you are seeing in the embryo, you know. So if that is the case, then we can talk about either are we doing PGD or is she using donor eggs? So, you know, those. So recurrent miscarriage is a topic on its own, okay? And then sometimes we can find out why the woman is having recurrent miscarriage, but the commonest thing probably will be age. You know? So sometimes IVF might be able to do that. Okay. Especially if you're using donor eggs. Okay.
A question just popped up because I realized some people have been asking questions, even though I've not answered it here. So a question just popped up now, and she was like, I think I've missed it. One was on prolactin, that someone with high prolactin, what is the solution to the treatment for high prolactin?
Well, yes, that's one question I always like answering, because we need to be careful. I hear a lot about hyperleptin. One thing that the rule of the thumb is that if you are menstruating regularly, and there is no galactoria, your breast is not bringing out milk, that your prolactin is not likely to be high. Now, but you could have high prolactin even when this does not happen, because prolactin is a non-stable hormone. So, for example, if you come from a hold up, or you have just experienced stress, the prolactin level can go up. Mm. So sometimes what we say is that if the prolactin level does not reach a particular level, you do need to treat. But I see everybody just treating prolactin, and then the menstrual cycle is regular, there is no galactoria, and they say they forever are treating prolactin level. And if you live in a city like Lagos, where by the time you are going to the hospital to take your blood sample for prolactin, somebody just hit your car or something like that, then you have a lot of high prolactin levels. So I think we need to be a little bit circumspect in this high prolactin. But prolactin, when it is high, can affect your ovulation, definitely. And that's why we say that when your menses is not regular, or you have your milk, you're secreting milk from your breast, when you are not breastfeeding, then those are some telltale signs of high prolactin.
Doctor, another question that just popped up while we were talking was, somebody said sorry, I couldn't get the name. I was just trying to get the question as fast as I could, that like she has been stimulated 3 cycles straight, and yet she didn't ovulate. That what do you think she should do in that situation?
I don't know what she means by she stimulated. Because it depends on what are we talking about. Is she use what I don't like mentioning drugs when I'm having this kind of program. Yeah, so it depends on who is stimulating, what they are using, and then because if all the problem is that you are not ovulating, is a make me shine kind of situation most of the time. It's probably one of the easiest problems that you can solve if all the problem is just that you're not ovulating. So it might be if the person can probably get in touch after the program so that can give us more information, and then I'll be able to help the person.
Okay, thank you. So Steph said she doesn't get answer to her question. I'm sorry, some of the questions I can't even see them. They are so fast. So I'm just trying to get one or two that I can really see. Another person said her husband has a bilateral hydrocele. That can it affect the sperm quality or the sperm count?
Yeah, they should. The tasting of the pudding is in the eating. Go and do the sperm test and then let us know what it is like.
Yes.
So, yeah.
Just the way you talked about high prolactin, another thing you see often, people keep talking about sperm leakage, that after intimacy that the sperm comes out. Please, I want you to talk more and enlighten us on sperm leakage.
Yes, the sperm, maybe let's say that the sperm that you see, the sperm sample that you see consists of 2 parts, the semen and the sperm cells. The sperm cells are living cells, so they move. Okay, so what you see when after intercourse is just the semen coming back. And so the sperm cells have moved, they are alive. So that is not, it doesn't harm anybody at all. So it's perfectly normal. What I always compare it to is the rocket. When they launch the rocket that goes to the moon, it goes with the fuselage. It gets to a particular level that the fuselage is discharged and it comes down to Earth. Yeah. That is what you see. The semen comes down, but the sperm cells are still on their way up. So I don't think there is a cause for concern. Women only talk about that when they're not getting pregnant. The people who get pregnant I never notice that.
Yes, that's true. Somebody was saying, Chizoba said, what is the solution to uterine polyps?
Well, uterine polyps, with hysteroscopy is the best way to, there are 2 ways, maybe. You could do, well, you can use drugs to make it shed. Depends on the kind of polyp. So, but the best way is hysteroscopy, where you see what you are doing and then get rid of the polyps.
Okay. I'm trying to get the question. Another person asked that she's on thyroxine drug, that can she get pregnant while she's taking it?
Well, it's better that your thyroid level, when you're taking thyroxine, means that you have thyroid problems. And it's better the thyroid gland is like the principal monitor of hormones, reproductive hormones. It's better that it's balanced before you try to achieve pregnancy. So I would say that probably a doctor must have placed this person on thyroxine. So go back to the doctor, let them do your thyroid function test again and be sure that it's normal before you get pregnant, because a lot of miscarriages also can be linked to this when thyroid is abnormal. So I think it's better that your thyroid level is good before you do your try to get pregnant.
This another question I have from my own self. And if for example, we know the finances with infertility is very, very difficult to treat. And a lot of people, so it causes stress and anxiety. Please, how do couples, because managing that stress and anxiety, it's not easy. It's very, very important. But a lot of people take it for granted because it will affect so many things you're doing. It could affect even their relationship. So how do couples manage stress and anxiety as a result of infertility?
Yeah, fantastic question. Yes, we know the financial aspect, but there's some things that are not very expensive as well. The first thing is getting knowledge.
Yeah.
You must be knowledgeable about any condition that you're facing.
Thank you, sir.
Yeah, so it's important for you to avail yourself of all the information so that even when you get your hard-earned money, you're not going to squander it on some things that cannot become babies. Because in the process of looking for cheap things, so many people have been taken for rides. So many people they're carrying babies that they carry babies home that they're not theirs, you know. So you need to know a lot. And then probably another thing that we're not doing very well, so much so in Nigeria, is the groups like yours, support groups. You need to join support groups because they tend to, you will see somebody that's going through the same thing that you're going through. And therefore, it's a fellowship, fellows in a ship. So you need to, and they also can guide you where not to go, where to go. Okay, because sometimes you don't have all that knowledge at once. Then you must also try to do some things together. Talk to professionals, even if you who can help with all this stress and so on and so forth. Do things together as a couple, and also there's some things you should take away from your lifestyle. Is very important.
That was going to be my next question.
Lifestyle is very, very important. The first thing is that, one, how old are you? People take that for granted a lot. I've seen somebody saying I'm 47. Yeah. If you are 47, it will take, I'm sorry to come like this, but I'm not insensitive, but I'm saying it as it is. If you are 47, it's it's very difficult for you to conceive naturally if you have never conceived before. Okay. So, and because there's so many things that are at play, some physiological things are at play for a 47, that against a 47-year-old getting pregnant for the first time. At any time, even for the 20th time, it's difficult because your chances of having chromosomally abnormal babies is very high. So age, the other things like your BMI, obesity does not work for anybody if you're trying to conceive, either the man or the woman. But even for the woman, being, too thin also does not work out for you. You have to be within the normal BMI range, which is about 18 to 29. So you need to be, and therefore what you eat is so important. You never go wrong with lean meat, with vegetables, with whole grain. Yeah, fiber, whole grain. You never go wrong with that. And moderate exercise. You never go wrong with that. Limit your caffeine, not more than 1 cup of coffee a day. Yeah. And then no smoking at all, either for the man or the woman, because it increases not only miscarriage rate, but even the chances that you get an ectopic if you get pregnant. Alcohol is also, if possible, 0, but very minimal, if at all. So those are some of the things that you need to, if you're a man, and then, you need to keep away from heat around your testes. Yeah. So the underwear, kind of sports, excessive cycling is not too good for you. So Okada might not be the best work for you to do. Working in fuel station might not be the best thing for you. Working in pay stations might not be the best thing for you. So those are some of the things that you might need to look out for when you are faced with infertility and you are trying to cope.
Sir, one of the issues we look at, I've talked about this funding, and I keep hammering on funding because it's so disheartening and painful to see that a woman whose only child is IVF, and then because of the fact that she cannot afford this, she stays like that. Is really, really disheartening. And I know, yes, we have so many things to look at that are more deadly, but than government. But is there not can come together, maybe like a plan for her to make funding available? Let's say like a gradual payment or a payment plan or something with the financial institution to like get something for that person who cannot generate of IVF.
Yeah, I know there's some banks that are doing that, and their interest rate is less than what obtains in the market. But of course, they have to do a risk assessment. That means you need to have a good job, as it were, before you can avail yourself to that. Maybe over time, they probably will have some other insurance company that might be able to come together to be able to fund that. But as of now, it's still in the realm of imagination and dream.
Yes, I'm even looking at NHI as being unfair because they don't cover. If you look at somebody with 4 kids, a husband and wife is being covered, while somebody that just she and the husband, you don't cover fertility treatment for them. That could be the only thing they even want. While they are contributing. So I think it's something that we as advocates should actually go into and put our heads together. I'm looking at it seriously from my point of view because it's not fair. According to World Health Organization, infertility is also a disease. So, and the psychological stress, I see women who wants to kill themselves. I want to die. I want to do this. Because of what they are going through. So it's not fair for them to be contributing. And what matters to them, they don't get any, they don't get answer to that, to their own, is not applicable. So if a man and 4 of his kids and his wife and himself, it could also relate to the other person. So I think I will talk to some people. I'm still thinking about it seriously, work with some other fertility advocates, and let's see how we could push. We need to start something. We can't just accept it and fold our hands that government, it's not attainable, it's not attainable. We need to start and even push and see how it goes. Even the awareness we're talking about, the stigma, the shame and everything with infertility, it's really something we also need to create awareness on. The people need to know that some of their words hurt. These people cannot tell you that these things you're saying hurt them. They go back and cry and they feel they can't fight back. You might just say it unknowingly without meaning anything because you don't know what that means. I remember my neighbor was telling me that my own is better. I'm not paying school fees. It pained me. She doesn't know how much I spend on fertility treatment that is more than even school fees.
Very true, very true.
So you see colleagues feeling that you don't have children. Why don't you wait behind on their behalf to do the job since you don't have children? Or you want to buy something, somebody carelessly says that, who are you buying this for? Do you have anything? So these things, so awareness.
I agree with you.
Sprouting everything, I think, is one thing we all have to come together and do. Creating that awareness is very, very necessary.
Very true.
We look forward, and also working towards 1 or 2 collaborations to create this awareness regarding stigma and then another thing is data. No data.
But it's the bane of, I think that's why they call us developing countries. We don't collect data. We don't use data even when they are available. So it's you're right. You're very correct. It's there are things we need to start looking at.
Do we still have time to take more questions?
I think we have a few. Yeah, we have a few more. Okay, we have like 7 more minutes. Yes.
Okay, thank you, sir. I think one of the questions I copied previously was sorry. Somebody was asking what is karyotype?
Okay. You know, when we say somebody is a man or a woman, there are different things involved. There is the genetic sex, and then so the genetic sex of a lady, if a lady is X, X. The genetic sex of a man is XY. Okay, so that's what we refer to as the karyotype. What is genetic sex? You can decide to be a boy even if you're a girl later on. That is sex of rearing. It's different. But I'm not mentioning any names. So yeah, so that's what we mean by your genetic sex. What is so? If there's a problem, for example, if you are supposed to be XX and you are XO, so that is an abnormal karyotype. Okay, and that's what happens in conditions we call Turner syndrome.
Mm-hmm. Shodim just asked right away that a man that has low motility and has been trying to improve it for the past 10 years, that can the person do IVF or IUI?
That's one great question. Again, why should anybody try to improve motility for 10 years in 2022? You see, because you know what the meaning of that now? His wife's age will be maybe 40s. And that you have reduced considerably the chances of you as a couple to get pregnant. So that's why for me, that's why we always say if you are less than 35 after 1 year, start trying. If you are, after you have tried for 2 years and you are not pregnant, get to go and do IVF, no matter what anybody tells you, because by then your wife now becomes too old and we cannot use her eggs. So it's important. There is nobody who should be trying to correct sperm for 10 years. So please, yes, this has happened, but we're saying this so that it doesn't happen in future to anybody who is listening to us. Yes, yes, the person can do IVF. That's just. But you know, I've just highlighted something now. Egg might now be a problem.
Because of the duration it has taken.
Exactly.
10 years, your chances have also reduced. The assurance for 10 years ago is different from the assurance right now.
Yeah, yeah.
Another last question, please. I think we still have about 2-3 minutes from the 7 minutes.
Yeah, we still have 4 minutes.
No, the doctor, somebody is saying that the doctor said the person can't try IVF. That's not what he's trying to say. He's saying that you shouldn't waste time trying to build a motility. Come right away and try. That you shouldn't wait 10 years to build. Not that the person can't try IVF. No, the person can try IVF. He's not saying the person can't try IVF. I think you did not get the explanation right.
Thank you. Thank you for putting the record straight.
Then, somebody asked, what causes ectopic pregnancy?
Ectopic pregnancy means that the pregnancy is not in the uterus where it is normally supposed to be. And most of the time is because the tubes are blocked. So either partially or totally blocked, but the embryo or the fertilized egg cannot just find its way to where it's supposed to be before it implants. So that is usually the commonest place where it is in the tube. And because the tube has limited space, When it starts growing, most of the time it will rupture after some time. And that becomes a surgical emergency most of the time. And so that's why we don't want that to happen. So
somebody chatted me up to this from South Africa, and she said her sister has ectopic pregnancy, that the doctor gave her a pill and said is going to push the pregnancy into the womb. And I told her, I don't know what kind of pill. I don't know what it's going to do to push the pregnancy to the womb, because I personally also had an ectopic pregnancy. I know it's just removal of the tube. So I had to put it up in my platform because I know she belongs there, so that she could see other people's response as well. And I don't understand what the doctor is doing. That's why doctor said knowledge is very, very important. It's very, very important for you to have knowledge of what you are doing. If not, you just waste money, or somebody takes advantage of you. In every procedure, even in the IVF, if you know what you're doing, you know when your doctor is not doing it right, you know when they are shortchanging you, you know what they're supposed to do and they're not doing. You need knowledge. Even infertility is expensive, very, very expensive. So you shouldn't even have knowledge of what to take. You see people, they're buying, when you buy even supplement, they say when you're buying supplement, what is your reason behind the supplement? What does it contain that is going to work, that will make him do what you want it to do? Is it vitamin? Is it folic acid? Is it vitamin? Is it vitamin C? So we need to shine our eyes, because a lot of people are going into fertility now as business, are seeing it that is lucrative. You see all sorts of ads on Facebook saying that, and you see different teachers saying, I have cure for this, I have cure for that. For God's sake, that word cure is very hard. And the way people abuse the word cure, it's really disheartening. So please, before we go, just few general advice for us before we go, sir.
Yes, well, maybe I just make a point on the ectopic, that it's possible now for you not to do surgery for ectopic. It's possible to, but there are few kinds of ectopic where you might do some injection and kill the pregnancy. I'm sorry to use that strong word, but that is what it means. So then you can just inject some things into your injection into the early pregnancy, and it stops it from going. But you need to be careful too, just like almost everything can be done, but be sure that the person who tells you is doing it can do it. Okay.
I actually had that injection during my day, and my beta HCG was being monitored.
Exactly.
At the point it was going down, but later it shot up again. So I knew my only option was just to go for the surgery. So pushing it to the uterus, how?
No, that sounds like science fiction. Okay.
Yes.
So, yeah, thank you very much for inviting me. So my last word to your listeners is that they should know that there is always hope. There is always something that can be done. The question is, do you want to make that choice yourself? And you can only know if you go to the right people who know what to do. So I just like you said, I'll just say, shine your eyes too. And please read, but please read the right things. You know, now there are a lot of misinformation even on the internet. People say I read it on the internet, but sometimes it's not authentic. So let's choose what to read and choose who to talk to. And there is nothing wrong in always getting a second opinion on anything, but also know who you are getting your second opinion. You don't take you want a second opinion, you go and talk to a shoemaker. You know, so you need to choose who you are talking to, even for a second opinion. And I'll say that with God with us, everything is possible. So I just wish everybody a happy and fruitful New Year.
Thank you so much, Doc, for coming. Really appreciate it. Please, if necessary, it's what you're going. Thank you so much. We hope to see you soonest again, and we're really grateful. Do have a nice day.
You too. Thank you so much. Thanks. Bye.